neat little lab. I think you'll like it. I think the last time I did this lab was in Jason's class, actually, so he remembers doing it. So if you will, key terms. This chapter is going to be a little different than how I normally present things, because when they went to this new edition on the textbook, I don't know what they were thinking, but they basically have the same objectives for the old textbook, but not the same material. So I've got to give you new material that basically answers objectives, and it's what I feel like is real important that they'll ask you about.
Book is ridiculous.
This textbook goes kind of with the A and P of the heart, where they want you to know how the heart works. That's all well and good, but that's not what they're going to test you on. They're not going to test you on, in the upper chambers and the lower chambers and how the blood circulates through the heart. I'm hoping you got that in A and P.
Yes,
Okay,
sir.
they're going to test you over what test do they do for congestive heart failure, what test do they do for acute heart attack, things like that. So that's how come I've given you a piece of paper that's typed out. So let's look at your key terms first. First word, angina pectoris. This basically means the pain that you feel when your heart basically is going constriction. Okay, that's a painful feeling. Angina pectoris. Basically, if somebody's fixing to have a heart attack, that's usually what they're going through. They feel the initial pain. All right. Arrhythmias. I'm sure some of you have heard of people that have arrhythmias. I'm a big candidate of that. Okay, arrhythmias is where you have an irregular heartbeat. Okay, and usually there's some examples. I think I've got them there for you. PACs, which would be premature atrial contractions or premature ventricular contractions. A lot of people have arrhythmias and they don't even know it. Some people can feel every single time their heart does not beat in perfect sequence, like myself. Okay, but then other people, they have the same arrhythmia, but they're kind of asymptomatic. They don't feel it as much. Okay, so understand and be able to give that definition for the word arrhythmia. Atherosclerosis, this is a disease in which there's an accumulation of lipid material in the veins and the arteries. I think we talked about another chapter where, atherosclerosis is a broad term, but there are different disease states that go with atherosclerosis. There is cerebrovascular disease, right? There is coronary artery disease, and there's even peripheral vascular disease. So basically, the terms that I just went over with you, we're talking about one of them, cerebrovascular disease. What do that cause in a patient? Stroke, right? What about peripheral vascular disease? What's an example of that? Like deep vein thrombosis, people get clots in their legs. Okay, that would be an example of peripheral vascular disease. And of course, coronary artery disease is when you're basically fixing to have a heart attack.
Yep.
All right? Or it can lead to that. Cardiac markers, that's your next definition. These are diagnostic tests or analytes used to assess cardiac function. When you guys go to clinicals, I will assure you, you will see these analytes. You will test for them. Patients especially that come to the ER or patients that are in the ICU because they had a heart attack and they diagnosed it in the ER, there is something that they do a certain amount of hours apart. Now, we used to call them, we used to do a barrage of tests, but they're starting to do fewer ones. But what they do is cardiac markers consist of the cardiac enzymes that we talked about before. You guys remember the CK, the CKMB, remember those isoenzymes of CK, right? But there's also cardiac markers called troponins. And troponins is the newest test out there that is a really, really good indicator that someone has had a heart attack. Basically, this marker will be elevated very shortly after the patient has the initial symptoms. And troponin T will even stay elevated for up to 5 days. So if that patient has had a heart attack, they go seek medical treatment. If there's a 5-day window there, we can almost pretty much assume they've had a heart attack by this troponin test that we'll talk about later. Okay? Now, blood test is not the only thing they're going to utilize to determine if someone has a heart attack. But these cardiac enzymes that we'll talk about today, they fluctuate depending upon how long ago the initial chest pain occurred, when the heart attack actually happened. Some of them stay elevated for a real long time. You guys remember me telling you, they hardly ever test for this for a heart attack anymore, but you can do an LDH level on someone that had a heart attack, and that marker will stay elevated for up to 10 days, okay?
People in renal failure, their troponin stays high forever because their body's not able to.
Right, yeah, right. But some of the markers, they're not real good because they go up real quick and then they return back to normal. An example of that is a myoglobin, okay? They don't do that very often, but a myoglobin rises real fast, but it goes back to normal. So if you're somebody like myself that kind of stays away from doctors, maybe they had a heart attack 3 days ago, you just did the myoglobin test, that test is gonna be normal even though they may have had a heart attack 3 days ago. Okay?
Hemoglobin and troponin, they're both proteins, is that correct?
Yes.
Thank you.
Yep. Yeah, in the cardiac markers now, they're gonna consist of enzymes. Remember CK, creatine kinase, right? And then you got the isoenzymes. So cardiac markers consist of both enzymes and proteins. Troponin and myoglobins, see, these things are in the myocardial muscle, all right? And so when you have a heart attack, there's damage to that muscle. So just kind of think of it like you got a muscle sitting there and then boom, you have a heart attack, it starts shaking, it's going without oxygen. Well, some of those markers that are inside that muscle are gonna spill out into the urine. Those enzymes, creatine kinase, troponin, myoglobin, all right? So that's what we look for when someone's had a heart attack. And those physicians, they know exactly those charts on which ones rise and peak at what times. So they normally don't just do one. Usually, unless it's changed, we can ask Jason, because he still works in chemistry. Usually if someone comes to the ER and they think they had a heart attack, they're gonna do a creatine kinase level, a CK. They also will do a CKMB, and then they'll also do a troponin, okay? And there'll be another test that we talk about a little bit called a BNP, but they normally do that for patients that they're thinking may have congestive heart failure, not necessarily a heart attack. All right, next key term, cardiac glycosides. These are drugs used to increase the contractility of the heart and slow the conduction of impulses. Now, we're not gonna be pharmacists when you graduate this program, but there's a reason that I want you to know what a cardiac glycoside is. It's because there is one major drug that they give to patients, okay, called a cardiac glycoside that are having heart troubles, and it's called digoxin, all right? They run that analyte on people all the time, and digoxin is a drug that is considered a cardiac glycoside. I hope I have that. Okay, you got an example? So I want you to remember that. An example of cardiac glycoside is digoxin. And again, the reason I think that's important, it's one of those analytes that when you're tested for in chemistry, it has critical values. I mean, I still remember it to this day when I would work in chemistry, any digoxin level over 2, we had to call it 4 because it can have severe side effects if it gets very high. I think somebody told me now that they kind of up the limit to where it can be as high as 3 before you have to call that to the 4. You don't want to have a patient that has a real high digoxin level and those nurses and doctors not know about it, okay? Now, just so you guys understand the importance of calling a critical result, it's not a perfect world out there. You may have a cardiac floor that has 40 patients on it, okay? Those results are constantly being updated in the computer or coming onto the printer. Sometimes they don't just instantly get those results and put it on the patient's chart and call the doctor, okay? So when we have an abnormal result, all right, that we have figured is something that needs immediate attention, you have to call that result, all right? And digoxin is a big one. You'll have to call that result a lot if you're working at an acute care hospital.
For nursing school, I went to nursing school for a while, but the digoxin, regardless like the level or whatever, they're close to a certain number, I think it's 60 or below, they don't give it anyway.
Okay, where we at? Cardiomyopathy. This is a disease of the heart muscle or myocardium. Congestive heart failure. This is very common actually in older people. We probably all know someone that may have went through congestive heart failure. There's really not a cure for congestive heart failure. So it results from the inability of the heart to pump blood effectively. A lot of times, these patients, you'll see fluid accumulation. They'll have fluid accumulation around the lungs, and they will also have edema around the ankles and in the legs. There's a reason when you go in for a physical, your general practitioner, a lot of times, they'll take just a second, feel around your ankles or your feet. They're feeling for swelling, okay? Because someone that has congestive heart failure, they're going to have excess fluid in the body, all right? You've heard me say many times in this class that sometimes you'll have to test a sample called a thoracentesis fluid. That's pleural fluid that comes from the lungs. A lot of your patients that have congestive heart failure, a physician has to go in with a needle and pull that fluid away from their lungs. It sounds like it's a horrific procedure, but those patients feel so much better when they have that fluid, because when you have so much fluid that builds up around your lungs,
You can't breathe.
you can get that fluid pulled off, those patients feel a lot better. Unfortunately, the fluid will come back. So a lot of people that have congestive heart failure, they have to go through this procedure more than just once, okay? Because that fluid is just gonna build back up. Does anyone know someone that's had that procedure done?
Yes. She was there. She
All right, diuretics, these are agents that reduce fluid volume and edema. You know, before they get to the point where they have to do a thoracentesis on you, they are going to try to control that excess fluid by medications, okay? And a lot of you may know that there's a diuretic called Lasix. That name, I always remember it because they say Lasix lasts 6 hours. Usually when they give that drug, it'll be good for about 6 hours. But a physician prescribes you Lasix, more than likely you're gonna void off a lot of urine, okay? You're gonna be voiding off urine all the time. And that will work for so long, okay? That can help you void off a lot of that excess fluid. But it's only gonna go for so long. Sometimes it gets to the point where they don't really have an option. They have to get thoracentesis. Okay, myocardial infarction. You guys know what that is? That's just a scientific name for a heart attack, all right? Myocardial infarction occurs when the blood flow to an area of the cardiac muscle is suddenly blocked, leads to ischemia and death of myocardial tissue. Myocarditis and pericarditis, basically, anytime you hear the word itis, that means inflammation of something. So those words kind of give themselves away. Inflammation of the myocardium and inflammation of the pericardium. Those are all muscles within the heart. Vasodilator drugs. These are drugs that dilate the peripheral arteries and veins. They decrease the amount of effort that the heart has to pump. A good example of a vasodilator drug is a nitroglycerin tablet. You got a nurse, my mom was a charge nurse on a cardiac floor at St. Joe. She would tell me a lot of times, you know, if there's a patient up there and they're in great risk for a heart attack and they start having chest pains, they put a nitroglycerin tablet underneath their tongue. Okay, that's the quickest way to get that drug in your body. They also have nitroglycerin patches. It comes in many different forms. I'm sure some of you know people that have had to have a nitroglycerin tablet.
What is that? It's right on the
Okay, troponins.
No, because
There are two different types of troponins. There's one called a troponin I, and there's one called a troponin T. Now, when I worked, we just called it a troponin, okay? But now they've separated the two. There's a couple things I want you to know. First of all, overall, I think that they just about came to feel that a troponin, if you could only run one test to determine a heart attack, a troponin is the test that you do, okay? If there was nothing else available as far as blood tests, okay? A troponin I is the specific marker for cardiac disease. So what that means is there are very few other disease conditions that will cause a false positive. So if you have a troponin I that's elevated, that's going to tell that physician, more than likely, this is not because this person has been strenuously exercising or has some other disease going on that is causing the troponin to be high. Specificity is specific for heart damage only. Does that make sense? So that's a good test if it narrows it down and you don't have false positives. Now, troponin T is the cardiac marker of choice that allows for both early and late diagnosis of a heart attack. one of the objectives that I want you to know about the heart is what is considered an ideal cardiac heart. Like what, if it was a perfect world, what would you want the characteristics of an ideal cardiac marker to be? And I'm gonna give you a bunch of different options on that. Like you want it to be cheap, right? You want it to be able to detect a small heart attack, also detect a large heart attack, and you know, and we're gonna talk about all those to where hopefully it'll make sense. But there is a question that I'm gonna ask you at the end of that. There is no ideal cardiac marker. There is not a blood test out there that is perfect, that has all of these different qualities that I'm gonna talk about, okay? But that's what pharmaceutical companies strive for when they make a drug, or if we're trying to determine a test, like what is the perfect test to where we could catch every single person that has a heart attack. I mean, I'm sure I'm not the only person in here. Have you guys ever, you know, just out throughout life, have you ever heard of those horrible stories where somebody goes to the emergency room and they have chest pain or they have indigestion and they send them home?
And then,
They go home and they die
yes,
like 4 hours later.
terrible.
Okay, we've all heard those stories, okay? And it happens. It's not a perfect world. There are people that go through the ER that for whatever reason it gets missed. The physician, they don't think that the person is in grave danger, and they send them home and then they die. You know, that happens every once in a while. So even though we're probably not ever gonna completely get rid of that, you want that to happen as less frequently as possible, right? And so they strive all the time to come up with better tests where no one gets sent home with their great. Beta blockers, these are drugs that reduce the heart rate and force of cardiac contractions. I told you guys, I don't think I have it written right there, but I told you guys there is a drug called Inderall, or you may have heard of propanolol. Those are drugs that are considered beta blockers, right? So I looked at the exam, for the next exam, there's you need to know those definitions. And those are important definitions, guys. Those are definitions where you're not gonna leave this program and go, I'm about to learn all that stuff. Those are things that you need to know working in the medical field, period. Okay, not just like.
So, and I've actually had people tell me the opposite. They went in, they thought they had a whole.
All right, so
But
the
it's
sheet
really
here.
just really terrible.
Everybody got a sheet?
And I've actually
I'm
gone
gonna
so
go ahead
far
and
as to go
apologize to
like
you guys.
circle
Pick
right
up a
to the
pencil
bottom.
because you're gonna have to write on the sheet. Okay, I'm gonna give you some notes that are gonna go along with this. I typed out the major points, but there's still gonna be some things you need to write in there. Okay, general symptoms of a person that has heart disease. Don't you think that's important? Okay, so we got it all broke down there for you. But if you don't know what some of these words mean, I'm gonna give you a little short definition, and you might wanna write that down, okay? The first thing is dyspnea. Anybody know what dyspnea is? Okay, so shortness of breath. That would be shortness of breath or difficulty breathing. What about the word syncope? Fainting or loss of consciousness. That usually has to do with inadequate blood flow. You guys are getting all these, maybe you don't have to write this down. What about cyanosis?
Blue color.
We're gonna learn all these words.
I think medical term, yeah.
You know, we need to change that in our program. I think medical terminology is such a good class. It's not actually a requirement for this program. But I try to tell all students if they gotta just take the course.
So what do you have for cyanosis?
Blue.
Bluish coloration of the skin. Again, these are all specific things that a patient presents that are symptoms that there's something going on with the heart. Of course, pain, we had a definition, like, you know, unfortunately, I wish they would just always say pain, okay, but they don't. So remember, pain / angina pectoris. That's the complicated way to say it. Angina pectoris, chest pain.
It's on your paper.
Palpitations, that's the next one, we already covered that, okay? That's any type of irregular heartbeat. Sometimes palpitations, there are some that are better than others, like PVCs, they say are really not that bad, but there are some types of palpitations that you don't really need to have, okay? But, if you need to put an example there for palpitations, I would put PVCs or PACs. Again, you got that in your definitions already. Patients are tired or they're fatigued, tired, they are exhausted. They can get exhausted just walking across a room, okay? That's another example of heart problems. And we mentioned earlier edema, and that's fluid accumulation. Usually it's gonna be in the ankles and the feet. That's where it's first noticeable, edema. If you don't have good circulation, and that could be from the primary source of that could be your heart's not pumping effectively.
Actually, Friday I watched the episode of my sister like for one of those patients that came to balance in the heart failure. Like she was losing weight, but it was already too far along.
Oh, yeah, that poor lady.
Okay, the next section that I've got on risk factors for acute coronary syndrome or atherosclerosis. We're gonna go through some things you might wanna jot down. Some of this information, again, it came from your textbook, but it came from an earlier edition, okay? So I'm not saying you can't research this information and the numbers will be slightly different, but overall, I'm gonna give you basically some statistics here. The age, generally, atherosclerosis is more common after the age of 40. Just like anything else, the older you get, usually the better chances you have of getting things that are unwanted. Sex, who do you think's more prone to have atherosclerosis, men or women?
Men.
Men, but, okay, I have written in my notes here, it is more common in men, but the statistics are equal after a female goes through menopause. Once a female goes through menopause, it's even Stevens. Family history. You know, this could go back to genetics and everything you want to talk about people like, my grandpa had a heart attack at 40, my dad had a heart attack at 41, so, you know, I'm probably very susceptible to have a heart attack I'm just talking in general, not mine, okay? So you might think that in general that you may be prone to have a heart attack at an early age. But some statistics, okay, and I just want you to think about this, you're not gonna be tested on it, and, is that if you think about family history, you've also gotta think about lifestyles. Like, you know, and again, I really can't prove this, but the book went in and talked about it a lot. For example, if your mom and dad are workout freaks, okay, every day they go jogging and riding bicycles and they eat healthy and, you know, they do everything right, there's a good chance that their kids while they're growing up are probably going to be, you know, kind of directed to eat healthy and they're gonna work out too. So if your parents, maybe they lead a sedentary lifestyle, they just don't do a lot, they sit around and watch TV. I'm not saying anything wrong with that, but I'm just saying if they do that, maybe their kids are prone to sit around and watch TV, okay? So you gotta look at that too, lifestyles, okay? You'll hear those stories about people that have eaten right all of their life, that have worked out right all of their life. I've probably told you guys this story before, but I worked for a pathologist who was probably the healthiest person I've ever met in my life, okay? And I'm not trying to make it sound, you know, way up there, but it was very, very surprising to me. This person ate perfect, okay? He worked out every single day, and he had to have a quadruple bypass when he was about 46, okay? He was so self-conscious about things. He was the guy I told you about that would always have a napkin before he walked through a door, and he would never touch a doorknob or anything. So there's always exceptions to the rules. I had a student one time in class, and you guys may work with this person at clinicals, but I think she told a story about, I think it was her grandfather lived to be 103 or something, smoked 2 packs of cigarettes every day since he was 18. And so, there's always exceptions to the rule, but I do think that they have proven for the most part that the healthier lifestyle, you know, and plus when you get into genetics and things like that, you just may not wanna take those chances. So anyway, family history is, you know, that's one of the ones where you kinda gotta think on that one. Hyperlipidemia, basically, they have associated, people that have increased serum cholesterols, there is a strong association with atherosclerosis. If you have a total cholesterol that's way up there, like 320 or 330, and then your LDL is high, and your HDL is low, that's not good, okay? There's a strong association between those people having problems, heart problems. Smoking. Actually, you know, the research I've done, there's a strong association with smoking and heart disease for men, but they really don't have it proven for women yet, okay? Not saying it's good to smoke, don't start, but they haven't really proven, as far as that textbook that I got this information from. High blood pressure, that's always hypertension. That's gonna be associated with men and women. A sedentary lifestyle, again, not being active. If you do very little, if you have very little movement in your body, okay, then you're gonna tend to be overweight. And if you're overweight, you may possibly, that can cause you to have high blood pressure and things. Again, I realize that everybody's different, okay? There's a lot of overweight people out there that it doesn't matter what they do, they're gonna be a little overweight because they got thyroid issues, okay? So again, not judging anyone, I'm just telling you guys what the information holds, all right? I know that I could lose some weight, so.
I have a question about thyroid real quick, if that's okay.
Yeah.
Okay, so when I went through what I went through the other day now, they did my TSH and it was 5.08 and the high range is 3.74. Is that just because what I was going through or I probably got one?
Well, I mean, I don't know, but you're probably on a lot of medication. A lot of medication can cause your thyroid to be off, you know,
Okay.
so I don't know.
Gotcha.
I wouldn't even begin to touch that.
Gotcha. I didn't know if just me
Yeah,
doing it, or if it's just.
yeah, but guys, there is a strong association again, there, you know, it's good to walk and to jog and to exercise regularly when you can. Diabetes, there is a association with diabetes and vascular disease, especially if it's not controlled diabetes. Now, here's one that, some people question sometimes, but it was in the textbook, response to stress. There is almost, they felt in this textbook anyway, that there was almost double the chance of heart damage or heart disease in people that are highly ambitious. Cool. So, like I said, that's, that kind of hit me off guard. I had a long talk with a friend of mine. He's the perfect candidate for that. He's a guy that, you know, just a workaholic, and he just doesn't hardly ever relaxes, if you know what I'm saying. You know what I mean? Like constantly just going 100 miles, you know, constantly. He might even be on vacation, but he's on his cell phone looking up numbers and just, you know, never gets distracted from work. And there is an association with highly ambitious people tend to be more prone to have heart issues and sometimes have major heart attacks, okay? I don't know what causes it out of that. They say it has to do with stress. They have proven that stress can cause lots of issues in your health.
Yeah.
Makes me think about your guy that, died at 46 or
I
whatever.
always
that
felt like
was
people like that don't like.
worried about door
Protect
handles, et
themselves.
cetera.
Mm-hmm.
He's constantly thinking, constantly worrying about stuff. That could be stressors.
Yeah, maybe.
In spite of the fact that he's making good decisions in other parts of his life, he's making bad decisions mentally.
Yeah. Yeah, I also know I know doctors that were avid, you know, all the time they were at the Y. I mean, I know a doctor that I think he died at the Y when he was walking.
On the treadmill.
Hmm?
On the treadmill. It was I had a pediatrician that happened to me. He was a very avid walker, runner, and he was running on the treadmill and just,
We're probably the same person.
yeah, Dr. Gardner.
Okay, so anyway, that's things to think about. Okay, features of an ideal cardiac marker. This is what I had referred to earlier. So we're talking about those tests, guys, like which I want you guys to see these tests because
Newton, Dr.
you need to see
Newton.
them over and over. CKMB, troponin. Anytime you hear words like this, we're talking about the heart, even a myoglobin. Okay, these right here are some biggies. I mean, we used to have to order, we did this panel on every patient that came to the ER with chest pain. I mean, you could just bet. And then when they got admitted in the ICU, they would do these same 4 tests every 8 hours on a patient, and they would always be stacked. Okay, those are all cardiac markers.
Wasn't there a CKBB and MM?
Yeah, those are the isoenzymes, you're right, okay, but if you'll remember, the MB is more specific for heart damage. There's one, like the CKMM that you're referring to, that one elevates anytime there's any type of skeletal muscle damage. So somebody that has muscular dystrophy or something like that, it'll be through the roof and it has nothing to do with their heart. So generally, if you're talking about the heart, the only isoenzyme of the CK that they do is gonna be this fraction called the CKMB. And I believe this is kind of what they call the hybrid type for muscle and brain. Okay, so which one and what would make one of those a perfect test, a perfect cardiac marker? So you don't really have to write nothing. I've got all those listed unless you need to write something that helps you to interpret. Absolutely heart specific. That goes with specificity. In other words, wouldn't it be nice to have a cardiac marker that when it's elevated, you knew it is coming from the heart, it's a heart problem, and it's not a kidney problem. See what I mean? Because that's a big difference between your kidneys aren't working and you're having a heart attack, right? So you want it to be heart specific, highly specific for heart damage only.
That could eliminate false positives.
Yes, yes, definitely. Okay, highly sensitive to detect minor heart damage. Okay, sometimes heart attacks, you have a heart attack, but it's a minor one. There's not a lot of muscle damage done to the heart. So don't you think it would be great to have one of these markers that can detect weak heart attacks, okay? That'll still be elevated, and what would really make it good is if a little bit of elevation means it's weak, and a big elevation means it's bad, all right? That would be another ideal feature of a cardiac marker. Monitor therapy and prognosis. Okay, so we have a person that had a heart attack and they give them medication for the heart attack. Maybe they don't have to do open heart surgery on them. So they give them meds. I don't know, there's all kinds of heart medications, but they give them meds. But wouldn't it be nice for one of these same markers, you can run that same marker again and it'll be a lot less. Basically telling the physicians this medication is working, okay? Easy to perform, cost effective. You know, those are big things. Quantitative, that goes with, again, how bad was the heart attack? You know, like the higher the cardiac marker, the worse the heart attack was. But, what's that?
Easy to measure.
Yep. But it needs to be easy to perform. It doesn't need to be one of those tests where somebody in the lab, unless you just do it absolutely perfect, you get the wrong results. Cost effective can go with any test in the lab. You don't want the test so expensive that patients can't pay for it or they refuse to have the test done on them. Differentiate reversible from irreversible damage. Okay, that would be another thing, good. Reversible, you had a weak heart attack, they can fix it, they don't have to do open heart surgery. Irreversible heart attack, massive heart attack, there has been heart damage, okay? Be able to distinguish the two. This goes along with specificity. Now, if you think about this when I say a marker should not be detectable in patients who do not have myocardial damage. Remember that myoglobin result? Myoglobin increases from any type of muscular damage. Remember that test question? I think, I told you scaffolding fell on a person and they were pinned under scaffolding for a long time.
Oh, yeah.
Okay, so your myoglobin is gonna leak out of the muscle tissue into the blood. Has nothing to do with a heart attack, you just had a crush injury that did muscle damage, okay? So you don't want a physician thinking that you had a heart attack when really you just had a car wreck, okay? And had a crush injury, and that's why your myoglobin's high. So you want it to be specific. Okay, the next page on this talks about some conditions called congenital heart diseases. Says the etiology in congenital heart disease is unknown. However, most defects appear to be multifactorial and reflect a combination of both genetic and environmental influences. So they have figured out that sometimes babies will be born and can have heart problems due to the mom had a rubella infection during pregnancy. You guys ever heard of that?
Mm-hmm.
Okay. They figured out that rubella virus can cross the placenta and do damage to the baby's heart. So there's certain disease states that a mom doesn't need or to get when they're pregnant. Maternal alcohol abuse. That's another thing. You're not supposed to drink when you're pregnant. They think that alcohol may be toxic to the fetal heart cells of the baby. Any type of genetic and chromosomal abnormalities. I mean, they have figured out that, unfortunately, a lot of babies that have Down syndrome and stuff like that, those conditions can be associated with heart problems when they get older. It doesn't mean they're all gonna have heart problems, but they're more at risk than someone that doesn't have it. Drug treatment and radiation, cancer is very, a lot of times people that have cancer, they have to go under radiation. When they're doing that radiation, as you guys know, a lot of times the radiation itself can do damage to the thyroid. It can also do damage to the heart if they're giving you radiation for like lung cancer, if they're having to get close to the heart. That if the radiation, they've proven that people that take chemo and radiation, sometimes that will do damage to the heart when they go through that treatment. Okay, congestive heart disease or heart failure. This results when the heart's unable to pump blood effectively. It is characterized by fluid accumulation in the lungs and possibly throughout the body. Now, in your analysis in body fluids, when we're talking about that class, we're going to be talking about pleural fluid coming up, and there's a procedure, again, called a thoracentesis. That's where they remove fluid from around the lungs. Okay, so things that can cause a person to have congestive heart failure or congestive heart disease. Any type of coronary artery disease. Cardiomyopathies, that's just any type of heart muscle damage. Inflammation of the myocardium. Some of you, have you guys ever heard of people having to have a valve replacement? Okay, that's just like open heart surgery. Okay, that's a big deal if somebody has to have a valve replacement. I think they're using pig valves to do that.
Yeah.
And cardiac arrhythmias, if you've had arrhythmias and let's say that you have them bad and you've had them ever since you're 20 years old, and arrhythmia is the heart isn't getting a full beat. Okay, that's what a temporary cessation or a skipped beat that you think you're feeling. Over long term, that could cause your heart to have to work harder, which means maybe it gives out a little bit sooner. Okay. Again, that doesn't mean if you have an occasional PVC that you're destined to have heart disease. I'm just talking about people that have them, have major issues with it.
My aunt she was sick, I think she was like flu or something, and it attacked her heart. She was like 39.
The virus did?
Yeah.
The flu
She had
did?
something like that. She had a heart transplant though, a
Oh,
couple months ago.
so is she doing good?
But she's doing right now. We can't see her anything right now.
Okay. All right, coronary heart disease or acute coronary syndrome. This disease is caused by a lack of nutrients and oxygen being able to reach the heart and resulting in a myocardial ischemia or restriction of blood supply to the heart. This basically means a heart attack, guys, okay, or a myocardial infarction. One thing that people don't think about a lot of this is some people actually have abnormal coronary arteries, okay, so they're more prone to have a clot in them. Now, that would be like a genetic abnormality, but that can be something that causes coronary syndromes. Any type of obstruction, I mean, think about it, that's what a heart attack is, right? You have some platelets and everything, I mean, it's a long process. Trust me, that chapter in your book on the heart, if you wanna read about it, it's all in there, because that's what that chapter is big on. But basically, you have inflammation take place, and you have these little fatty streak deposits that build up in the arteries, and platelets come by and they kind of stick to it. That's what eventually causes that thrombus formation, okay, that can lead a person to have a heart attack. And then, of course, atherosclerosis, and that's just a thickening of the walls of the arteries and vessels. Okay, heart disease caused by high blood pressure. On the last page of your handout, it says hypertension, which you need to know means high blood pressure, is defined as a systolic pressure greater than 160 millimeters of mercury and a diastolic pressure greater than 95. Okay? Now, I don't know about you, but I've always been told the normal should be 120/80. But that seems like it changes every once in a while, and they make it a little tougher on you. Okay? But for this class, I want you to recognize it's 120/80 being normal blood pressure. It is one of the most common vascular diseases is heart disease due to high blood pressure. It says the increased blood pressure is caused by an increase in peripheral resistance that results in heart disease. Basically, if your blood is having to pump harder through those vessels, okay, that means the heart is having to work harder to do that. That's one reason they give you drugs sometimes that widen those arteries. They make that hole bigger so the heart doesn't have to pump quite as hard to make it go through there.
That's vasodilation?
Yep. Like all other diseases, there are symptoms that they associate with high blood pressure. Okay, they feel like there is a strong association with obesity, heavy alcohol use, smoking, and again, sedentary lifestyles, people that are not very active. Infectious heart disease, these are diseases basically that can be caused by infectious agents. We talked earlier about rheumatic heart disease. That's that rheumatic fever or group A beta hemolytic strep. Okay, there's a side effect that can do damage to the heart. Infective endocarditis. This is a complication from certain staph and strep infections. Pericarditis. This is believed to be caused by bacteria, viruses, and funguses. Also, autoimmune disorders can cause pericarditis or inflammation of the pericardium.
What? That's the last thing he said. Okay.
So you get most of it.
Okay, did you guys write down that there is a test, and you can read about this in your chapter, but I'm just gonna make it point blank why it's important. There's a test called a BNP, brain nitride peptide. It's in your textbook if you wanna read about it, but it is a test that is used, okay, to diagnose people with congestive heart failure. BNP. BNP. That is used for people if they feel like having congestive heart failure. And basically the principle of it is it can detect that expanded volume or the stretch of the ventricular muscles of the heart. Okay, read about it. It'll explain it all to you, but we got too much stuff to do today, so I just want you to kind of associate that right now, okay? Now, I do want to go over some stuff that, again, that I just, some of these are your key terms, but this is an objective that I want you to be able to associate common types of cardiac drugs. drugs that are used to help heart patients, okay? A lot of these, you guys already know them, it's common sense, okay? But I do wanna go through these, and you may wanna write these down, because I don't think this was on your handout. The first one is gonna be vasodilator drugs. This was a key term you had, but just be able to associate, for example, nitroglycerin is an example of a vasodilator drug. Number two, diuretics. Somebody give me an example of a diuretic.
Lasix.
Lasix, right? It's gonna make you void out a lot of urine to decrease your fluid volume.
Sorry, what was an example of that first one?
Nitroglycerin.
Nitroglycerin, there's other ones, there's like captopril. That's all I can think of right now. Okay, diuretics again, Lasix, there is drugs called beta blockers. You guys have heard of those, right? They give you beta blockers. Cardiac glycosides, you have that definition, but I want you to make sure that you can associate digoxin is a real good example of a cardiac glycoside. And then anticoagulants, you guys already know what those are, right? But those are drugs that prevent venous thrombosis, and sometimes they can prevent the reoccurrence of an embolism that you have. So you guys give me some examples of anticoagulants.
Aspirin?
What?
Is aspirin an anticoagulant?
Is that gonna be like liquid?
Well, you're,
Coumadin.
yeah, I want the
Oh,
whole
okay,
passion.
okay.
Coumadin, heparin,
Yeah.
warfarin is a derivative of Coumadin, yeah. Yeah, that's what I want you to write down, heparin, Coumadin, and warfarin. Those are good examples of anticoagulants.
I got a bruise from that stupid little thing.
Okay, so, we've covered everything except probably the most common one that doctors will tell you to take. What's the other one?
Aspirin.
A baby aspirin, right? A lot of physicians will tell you that you are a person that may be susceptible to having a stroke or a heart attack. They'll tell you to take an aspirin. How do aspirins work? You guys remember what they have an effect on?
The platelets say disabled.
They're an antiplatelet drug, okay? They cause your platelets actually not to work.
For how long of a period overnight?
Usually when you take an aspirin, it will have an effect on your platelets for 5 days. And some books are gonna say 5 to 7, but around 5 days is how I remember it. Sometimes, I know I got this from my mom, because I told you she was a heart person, but, she had told me that even on the floors, that sometimes if there's a patient in a bed at a hospital and they start having chest pain, the physician will say just to give them a 325 milligram aspirin, like immediately. Okay.
This would be for Charles in my internal medical profession class, is that you expect my head heart and use the baby aspirin called.
Yeah. But believe it or not, you know how things change. I did hear them say that there's new studies out now saying that they don't know if taking a baby aspirin is of benefit in certain populations.
And I think it might actually be detrimental.
Just like,
to
you know
certain
how when you go
people,
to,
too.
you know how they used to do CPR, people that had to be CPR certified, and there's always telling you about doing the chest compressions and the mouth-to-mouth resuscitation, and they're even modifying that method now, saying that that's not always perfect, the way that they've been training people to do it for years and years and years.
That's why you get the clear thing. You know, they got these things in bigger cities now. I just seen it last night. It's drones that get to anywhere in the city, and they have like the CPR, like the mouth covers. They have like the
defibrillator.
defibrillators, everything.
Really? Well, that's pretty neat.
That's really cool. Helicopter.
I know, but you can put a little
Um,
device in the thing.
Cause our lucky one shocking or killing somebody. Could.
Or it'll fall out of the sky and just.
Okay, another
it's
objective,
funny.
another objective that I want you guys to think about is they are coming up, they need to figure out tests where they can predict people that may have a heart attack in the future, okay? Now, I know that they do lipid tests and they can do total cholesterol and all that, but there are some tests that you can read about in the cardiac chapter that basically, two of them are real easy because they detect inflammation, okay? Inflammation, they do feel like can be a predictor of someone that is going to have heart issues in the future. So there is a test, the C-reactive protein. Again, I'm talking about tests that can predict heart disease in the future. The C-reactive protein. Number 2 is fibrinogen. Fibrinogen levels, remember that's an acute phase reactant too that detects inflammation. A D-dimer.
Hang on.
Hold on.
Alright, I'll say them again. CRP, C-reactive protein, CRP, number 1. Number 2, fibrinogen. Number 3, a D-dimer.
That, blood clots too, right?
The D-dimers detect that there's a clot somewhere and the body's trying to break it down. And then there's another test called a homocysteine. Homocysteine level.
And it's got its own little pretty little pearl light too.
Okay, now, I've got in my notes, and I'm glad I wrote this down. You're not gonna be tested on this, I just want you to listen to me so you can kind of put some of this stuff together. A lot of times, patients that are in the ER, or they're up on the floor, or they're having open heart surgery, there's a strong association between open hearts and the blood bank, okay? Because people that are having open heart surgery and things, that they've got heart problems, they normally always, especially if they're going to surgery, they will usually have a minimum of a 4-unit cross match set up.
Okay.
And you guys in blood bank have been doing 1 or 2 unit cross matches because we're so skimpish on pigtails, right? But in a real blood bank, anyone that's having open heart surgery, hopefully they're not even gonna have to use 1 of those units, okay? But you just need to, I want you guys to recognize the fact that heart surgeries go with blood bank and can kind of tie a lot of this stuff together. Like there's certain things that you may not, I'm sure Jason has went over, but every place I know of, they will not do an open heart surgery unless there is a platelet pheresis in-house on the agitator. As he talked to you guys about the platelet pheresis, get that room temperature, okay? I've had to call people before while I'm working in blood bank, and you know, around the holidays, there's usually a shortage of blood products, and they will not do an open heart surgery unless you have a platelet pheresis available. It doesn't mean they're gonna get it, and they don't get it 90% of the time, but they can't do it. They will not do that procedure without platelet pheresis on it. I've actually had to call people on Christmas morning and call blood services and have them, you don't have to do it, but I would have to have somebody drive to Y City and meet somebody coming from Oklahoma that would drop off that platelet pheresis and drive it to St. Joe Hospital because they were so short, no one had platelet pheresis. Oh yeah, one more thing, there's a case study I need to refer you guys to. This is chapter 26, right?
Yes, sir.
Okay, on chapter 26, on page 536, I want you to read page 536 and 537. It's going to talk about that CK enzyme, and it's also going to talk about the troponins. The information about the BNP can be found on page 541 that I just kind of briefly went over. Now I want you to be very familiar with page 542, that case study 26.4. Wanna go with that?
26.
You
Yes,
feel like
sir.
you learned anything from the part?
Yeah.
A little bit? Okay, let me just talk to you about real quick what we're gonna do for lab. This will give us a little bit of of time, and, we're doing good. We got that knocked out in an hour. I don't know how long this lab will take, but if we have time at the end, and it's not 11 o'clock, I'll come in here with the exams. For those of you that wanna look at them, I'll have the key and we can talk about them, how I scored it and all of that, okay? And guys, I suggest, you know, a lot of you, I know you're taking for granted thinking that I'm perfect, but you're not gonna rival me at all if you, wanna look at your test. Make sure I graded it right. You know, I've had students before that catch me on something where they should've got 2 more points, you know? And I don't mind, come to my office and say, hey, let me look at it, just tell me how you scored it or whatever, because, you know my rule, if I did it to your disadvantage, I'll fix it. No, yeah, and if I did it to your advantage, don't tell me about it.
Yes, sir.
Alright? Okay. So anyway, we're gonna do a neat lab today, I think you guys will like it. I think we got everything set out in there. We're gonna basically get some cheek cells and we're gonna make our DNA, and it's actually gonna come out, it's gonna precipitate, you'll see it. For those of you that want to, you can actually put it in a necklace. I think I've got all the stuff in there to where you can make your necklace. It's gonna be a cookbook thing, okay? It is step by step. I've got one, what I call a community table in there that has everything in it, table 4, back here in the back, all right? If at any time you're reading your directions and you get confused, like where is that? It's at the community table. Even if your directions say, hey, the protease reagent your instructor has in a little pink vial at your table, no, I don't. I've got it at the community table, okay? It just makes it easier for me. So I've got everything you'll need in there set at the community table, and you're welcome to take stuff back to your workstation if you need it, but everything is there. It will require a water bath, and the water bath is in the prep area back there,
Yes, sir.
okay?